Welcome to our channel Striving for Better Life, and with our comprehensive guide to maintaining normal blood sugar levels. Whether you have diabetes or are simply aiming to follow a healthier lifestyle, understanding how to keep your blood sugar stable is crucial. Let's dive into 7 proven strategies that will put you in control of your health. So let's get started. We have to know first: what is the normal blood sugar level? What doctors consider normal blood sugar depends on your medical history. For example, if you have or have ever had diabetes, and the last time you ate something and exercised. Blood sugar is measured in terms of milligrams of sugar per deciliter of blood, and measurements are often taken in the morning after fasting overnight. The following blood sugar measurements are considered healthy and normal according to health authorities, including the American Diabetes Association. If you are generally healthy, you do not have diabetes, and have not eaten anything in the past 8 hours, you are fasting. It is normal for the blood sugar level to range between 70 to 99 milligrams per deciliter, less than 100 milligrams per deciliter. If you are healthy and have eaten within the past 2 hours, it is normal for your blood sugar level to be less than 140 milligrams per deciliter. If you have a history of diabetes, your fasting glucose level must also be less than 100 milligrams per deciliter, which may need to be managed with insulin. It is also considered healthy, as its levels range between 70 to 130 before eating. If you have diabetes and have eaten within the past 2 hours, the goal is to lower your blood sugar to less than 180 milligrams per deciliter. If you have diabetes, you want to maintain your blood sugar between 100 to 140 milligrams per deciliter before bed and at least 100 milligrams per deciliter before exercise. Signs of high or low blood sugar. Even without measuring blood sugar levels, there are certain clues that things may not be normal. How do you know if you're not managing your blood sugar levels successfully throughout the day? Common signs and symptoms that should not be ignored that may indicate diabetes and fluctuating blood sugar levels include fatigue or chronic fatigue syndrome, low energy levels, sugar/carbohydrate cravings, extreme thirst, weight fluctuations/weight loss, increased urination, mood swings, irritability or nervousness, blurred vision and its worsening, slow healing of skin wounds, dryness, cuts and bruises, recurrent infections, heavy breathing and difficulty exercising. You have a headache. Causes of abnormally high blood sugar. People who tend to experience fluctuating, abnormal blood sugar levels include 1. Anyone suffering from diabetes or prediabetes. 2. Those who follow a poor diet rich in sugar, refined grains, artificial ingredients, and canned foods. 3. People who skip meals, do not eat enough, or follow a fad diet. 4. Anyone who does not eat at the time of exercise, before or after exercise, to help refuel. 5. People who do not get enough sleep and live with large amounts of chronic stress. 6. Pregnant women, who may be at risk of developing gestational diabetes. 7. People who have a history of insulin resistance or diabetes in their family. Your diet is the single most influential factor when it comes to blood sugar levels. The foods we eat fall into one of 3 categories: carbohydrates, sugars and starches, proteins, and fats. Sometimes fats do not affect blood sugar, while carbohydrates and to some extent proteins do. Carbohydrates in our diet, along with part of the protein we eat, are converted into glucose, which provides cells with most of their energy and helps fuel the majority of the body's many functions. Glucose requires the introduction of insulin into the cells, the hormone secreted by the pancreas that is most important for controlling blood sugar. When we eat carbohydrates or proteins, the blood sugar level rises, which alerts the body to produce more insulin in order to bring the levels back to normal by getting sugar into the cells. Insulin levels rise and fall depending on our diet, and are also affected by levels of other hormones, such as cortisol. In people with diabetes, whether type 1 or type 2, cells stop responding to insulin the way they should, and the process described above begins to break down. Either the pancreas does not produce enough insulin, or the cells no longer respond to normal amounts of insulin, called insulin resistance. This is where lifestyle and diet for diabetes management become particularly important. Problems maintaining normal blood sugar can arise when insulin release mechanisms no longer work as they should. Specifically, beta cells within the pancreas stop reacting to changes in blood sugar normally, and too little insulin is produced, resulting in high blood sugar. Also, when blood sugar levels are not managed, hyperglycemia and hypoglycemia can occur with levels rising and falling dramatically. These come with many side effects that indicate prediabetes or diabetes, including fatigue, sugar cravings, changes in blood pressure, weight loss or gain, nerve damage, and nervousness. The cells stop receiving enough energy because insulin is no longer doing its job of providing enough glucose, sugar. Meanwhile, blood glucose levels can remain high, leading to damage to the kidneys, heart, arteries, and nerves, which in turn negatively affects the entire body. How to maintain normal blood sugar levels? Most of the habits that help us maintain healthy, normal blood sugar levels are fairly straightforward and easy to implement. However, some may also surprise you, especially if you think it will be difficult to start managing your blood sugar better. Small changes to your diet, exercise routine, and sleep schedule can make a big difference when it comes to managing your blood sugar. Let's take a look at some of the best ways to help put you on the right track to achieving and maintaining normal blood sugar levels for life. Which is next? 1. Eat a minimally processed, anti-inflammatory diet. A healthy diet is key to managing blood sugar and preventing or treating diabetes. This doesn't mean you should avoid eating any carbs or sugar when trying to maintain normal blood sugar. You just need to balance it with protein/fat and focus on getting it from real, whole foods. Eating a source of protein, fiber, and healthy fats with all of your meals can help stabilize your blood sugar, especially when eating carbohydrates/sugar, such as starchy vegetables like potatoes, fruit, or whole grains. These slow the absorption of sugar into your bloodstream, help control your appetite, and are important for metabolism and digestion. Some of the best protein foods for blood sugar control include wild fish such as salmon and eggs, grass-fed beef or lamb, raw dairy products, including yogurt, kefir, or raw cheese, and pasture-raised poultry. Healthy fats include virgin coconut oil, MCT oil, extra virgin olive oil, nuts and seeds, such as almonds, chia, hemp, and flax, and avocados. Coconut oil, ghee, and grass-fed butter are favorite fat-burning foods to control blood glucose levels while improving the taste and quality of your meals. High-fiber foods include fresh vegetables, whole pieces of fruit, not juice, beans or peas, and ancient grains. Some of my favorite foods, especially those high in fiber, are artichokes, green leafy vegetables, chia seeds, flax seeds, apples, pumpkin seeds, almonds, avocados, and sweet potatoes. Consider using a berberine supplement to control blood sugar and fat metabolism as effectively as metformin, which researchers describe as a potent oral hypoglycemic agent. A study published in the International Journal of Cardiology showed that red yeast rice extract may also help maintain normal blood sugar levels. This study specifically looked at the effects of supplements containing berberine, red yeast rice, and polycosanol. Other foods and drinks that make great additions to a glycemic stabilizer diet include apple cider vinegar, cinnamon, green tea, herbal teas, and fresh herbs and spices. 2. Switch carbs and sweeteners. While all types of added sugars are capable of raising blood sugar levels, some sources of sugar/carbohydrates affect blood sugar levels more than others. When used in moderation, natural/unrefined organic sources of sugar, such as those found in fruit or raw honey, are less likely to contribute to poor blood sugar management than refined sugars, such as white cane sugar or refined products made with white sugar/bleached wheat flour. To help maintain normal blood sugar, check ingredient labels carefully as sugar can be listed under dozens of different names. Skip anything made with refined flour, also called wheat flour or enriched flour, and added sugars, such as beet sugar/beet juice, cane sugar, high fructose corn syrup, fructose, and dextrose. Instead, choose natural sweeteners, including raw honey, organic stevia, dates, pure maple syrup, or blackstrap molasses. Most importantly, watch your portion sizes, using only a small amount daily of natural sweeteners, such as 1 to 3 teaspoons daily. When it comes to grain flour products, it's best to consume whole grains whenever possible rather than in flour form, which can cause your blood sugar to spike even more. But if you must use flour, choose those made with 100% whole grains, or try coconut flour or almond flour for a healthier option. Regarding drinks, stick to water, soda, herbal or black tea, and coffee. It is best to drink coffee in moderation, i.e. 1 or 2 cups a day, especially compared to sweetened drinks, juices, or soft drinks. Keep in mind that alcohol can also raise your blood sugar, especially if you consume sweetened alcoholic beverages, such as some dessert/fortified wines, sherry, liqueurs, juice drinks, and apple juice. 3. Exercise regularly. You probably already know that there are dozens of benefits associated with exercise. According to the National Diabetes Association, exercise manages blood sugar in more ways than one. Short-term exercise helps cells in your muscles absorb more glucose to use for energy and tissue repair, lowering blood sugar in the process. Long-term exercise also makes cells more responsive to insulin and helps prevent resistance. Getting 30 to 60 minutes of exercise most days of the week, such as running, cycling, swimming, and weightlifting, is also a simple and beneficial way to reduce inflammation, manage stress, improve immunity, and balance hormones. Insulin sensitivity increases so that your cells are better able to use any available insulin to absorb glucose during and after activity. 4. Stress management. Excessive stress can actually cause blood sugar levels to rise due to increased secretion of cortisol, the stress hormone. Stress triggers a vicious hormonal cycle in many people. Not only does it contribute to high blood sugar by raising cortisol, but it also tends to increase cravings for comfort foods, many of which are refined and full of sugar or other inflammatory ingredients, and often interferes with getting good sleep. Everywhere, dealing with large amounts of stress makes it less likely that people will take good care of themselves and maintain healthy habits that contribute to maintaining normal blood sugar. For example, skipping exercise and drinking more alcohol and caffeine are common among adults who suffer from chronic stress. These self-destructive habits contribute to increased stress, which further interferes with blood sugar management. It is no wonder that people who suffer from health problems such as diabetes or heart disease, or even who end up gaining a lot of weight and face obesity, tend to feel depressed and hopeless but find it difficult to break the cycle and develop new habits. What are some ways you can help deal with the inevitable stressors that occur in life? Studies have found that natural stress relievers, including exercise, yoga, meditation, and using anxiety-relaxing essential oils, such as lavender, rose, and frankincense, are all beneficial for diabetics and those with insulin resistance. Other ways to relax include spending more time outside, joining groups in your community, and connecting with family and friends more. 5. Get enough rest. Getting good rest is crucial to maintaining a healthy outlook on life, adhering to healthy habits, and even managing hormone levels. Lack of sleep can increase stress and appetite hormones, like cortisol and ghrelin, which make you hungry, making it difficult to avoid sugary snacks, refined grain products, and caffeine overdose. Sleep and metabolic processes are linked in several key ways, and research shows that our natural circadian rhythms can lead to high blood glucose or increase the risk of diabetes when they are disturbed. Sleeping too little, getting poor sleep, or sleeping at the wrong times can impair insulin secretion even if you don't change your diet. Aim to get between 7 and 9 hours of sleep each night, and it's best to stick to a regular sleep-wake schedule in order to balance your hormones, reduce stress responses, and have enough energy to exercise and get through your day. Summary of this video. High blood sugar levels for a long period of time can push a person with prediabetes to develop full-blown diabetes, which now affects 1 in 3 adults in the United States. People who tend to experience fluctuating, abnormal blood sugar levels include anyone with prediabetes or prediabetes, those with a poor diet, high in sugar, refined grains, artificial ingredients, and packaged foods, people who skip meals, do not eat enough or follow fad diets, anyone who does not eat at the time of exercise, before or after exercise to help refuel, people who do not get enough sleep and live with large amounts of chronic stress, pregnant women, who may be at risk of developing gestational diabetes, and people with a history of insulin resistance/diabetes in their family. Signs of high/low blood sugar include fatigue and low energy levels, sugar/carbohydrate cravings, extreme thirst, weight fluctuations/weight loss, increased urination, mood swings, irritability, blurred vision and its worsening, slow healing of skin wounds, dryness, cuts and bruises, recurrent infections, heavy breathing and difficulty exercising, and headaches resulting from tension. In order to achieve and maintain normal blood sugar levels, eat a low-processed, anti-inflammatory diet that includes protein foods, healthy fats, and high-fiber foods. Switch carbohydrates and sweeteners, avoid refined flour and use natural sweeteners in moderation. Do exercise regularly. Stress control, and get enough rest. By incorporating these 7 proven strategies into your daily life, you can achieve greater control of your blood sugar levels and pave the way for a healthier future. Remember that small changes can lead to significant results. Stay committed to your well-being and follow a balanced lifestyle for optimal health and vitality. Don't forget to subscribe to our channel. Don't forget to look at the products in the description box if you need them.